Medicare decisions are important because once you go on Medicare, this is your healthcare coverage for the rest of your life. And for many of you, your decisions will impact somebody very special to you, and that is your spouse. So I'm going to go over which Medicare decisions you need to make with your spouse in mind. Medicare is an individual program, which means that your Medicare plan is specific to you. Your Medicare plan arrangements will not cover your spouse, so whatever options that you choose with original Medicare and a supplement plan or a Medicare Advantage plan, that coverage will apply to you and to you only. Despite being an individual plan, by the end of this video, you'll see that Medicare is something that you will definitely want to plan together with your spouse. Now, the first big decision is whether you should even take Medicare or not. Most people in America get their healthcare coverage through some form of employer-sponsored plan, and if you are covered by your employer, you have a choice around whether or not to take Medicare at 65 years old. If your employer has 20 or more employees and your coverage is strong and you aren't paying anything for it, or you pay very little each month to cover you and your spouse, you can stay on your company plan past age 65, delay Medicare, and wait until you no longer have that company coverage before you get Medicare. You won't have any penalties as long as you are covered by your company plan. However, if your employer coverage is costly, Medicare costs may be lower and coverage stronger than your employer coverage. So switching over to Medicare may make a lot of sense. But this video is all about our spouse. So what if you have a spouse? In this situation, if you are the one employed and your spouse is covered under your company health insurance, if you move off of the company plan and onto Medicare, your spouse is affected. See, you were paying attention earlier and you know that Medicare is an individual plan, so when you move off of your company plan and onto Medicare, your spouse is most likely no longer going to be covered by your company plan. So what will cover your spouse? You're left with two options. The first is if your spouse is also Medicare eligible, then there really is no problem. You can both go onto Medicare and pick your individual plans. Everything is pretty straightforward and easy. The second is a little bit more complicated. So maybe you are 65 years old, but your spouse is 62. Your spouse is not eligible for Medicare, and your company plan most likely won't cover non-employees. So your spouse is left needing to either get an individual plan on the marketplace or possibly a COBRA plan if that's available. Both of these options are typically quite expensive for the coverage that you're used to. So the very first decision you have on whether or not to begin Medicare must involve your spouse, taking into consideration his or her insurance coverage options. The other factor to consider when looking at company-sponsored insurance is the Health Savings Account, or HSA. Many companies offer an HSA, and the company can contribute dollars to your HSA on your behalf. Now, you must be covered by a qualified, high-deductible health plan, and HSAs have maximum contribution limits that you can make each year that are based on whether your health plan is a family plan, so you and your spouse or another dependent, or an individual plan, meaning just you. In 2023, the individual limit is $3,850. The family limit is $7,750. Additionally, after age 55, you're allowed to make what are called catch-up contributions to your HSA, which is another $1,000 you may contribute each year, taking your individual limit to $4,850 and your family limit to $8,750. Now, this is leading somewhere because HSAs and Medicare do not play nice together. As soon as you take any form of Medicare, whether that is Part A only or it's Part A and Part B, you and your employer must stop making contributions to your HSA. Where your spouse comes in this scenario is that if you are the one working, both you and your spouse are covered by your company plan. Let's say that your spouse becomes Medicare eligible and takes Medicare while you do not. There are two options to consider here. Number one, your spouse stays on your company plan. Maybe your spouse just took the no-cost Part A option, so they don't need to pay the Part B premium, and your spouse stays on your company plan. In this case, you are still covered by the company family plan because it includes you and your spouse. It is your HSA since you are the policyholder through work, and this means that you and your company may continue contributing to your HSA up to the family maximum for that year. That's a good thing. The second option would be if your spouse takes Medicare and moves off of your company plan. This can happen if the company plan is expensive to cover a spouse and Medicare has stronger coverage at a lower cost. If this happens, now you are the only one covered by your company plan. I think you see where this is going. This means that your HSA is now only eligible for the individual contribution limit, not the family contribution limit. Okay, that wraps up our HSA situation. There are some other scenarios that may come up. Feel free to throw yours in the comments and we can answer yours individually. Let's move on to Medicare costs and how they affect your spouse. Moving forward, we are assuming that you have decided that you are going on Medicare. So now you need to figure out what it will cost you and how much coverage that you are going to get with your spouse in mind. Original Medicare is made up of Part A and Part B. Both have potential premiums, meaning monthly costs that you need to pay to even have the coverage, whether you use the healthcare system or not. Part A is your hospital coverage. Think of it as your rent to stay in the hospital. It also covers things like skilled nursing facility care after a hospital visit, some home health care after a hospital visit, and hospice care. Most people pay $0 for Part A because Part A is provided to you through the government as a result of you paying into the Medicare system through your taxes throughout most of your life. To qualify for no premium Part A, you must have worked and contributed to the Medicare system through your taxes for at least 40 quarters, which is the equivalent of 10 years. But wait, there are a lot of spousal arrangements where one spouse worked while the other did not. Since Medicare is an individual plan, does that mean that the spouse who did not work will need to pay Part A premiums? The answer is no. Despite being an individual plan, when considering Part A premiums, you can qualify for no-cost Part A based on your spouse's work history. So if either one of you worked 40 quarters or 10 years individually, the other one can qualify for no-cost Part A. So that's pretty nice. It is not a combined work history though, meaning they won't combine you working 5 years and your spouse working 5 years to equal 10 years. That's not how it works. Now Part B is different. Part B goes back to throwing you into the individual plan aspects for your premiums with a wrinkle on how your premiums are calculated. Part B premiums, again, the monthly cost that you need to pay to even have coverage, whether you use healthcare or not, starts at $164.90 in 2023. That amount is per person per month. There are exceptions for those with low incomes who are on Medicaid, but for the vast majority of Americans, they will pay $164.90 per month. Part B premiums are income-based, and if you and your spouse have a higher income and you file taxes jointly, you could see the income-related monthly adjustment amount, or IRMA. This means that you would need to pay these higher amounts here for your monthly Part B premiums. And you guessed it, those amounts are per person, not combined. Those contribution limits are shown here. Additionally, and here's where things get tough in my mind, you and your spouse will each have to pay those amounts based on your combined household income. Now wait a minute. What if I work and most or all of the income is mine? Are you saying that my spouse still has to pay higher amounts even though he or she has zero or low income? Yes, that's exactly what I'm saying. Just like the Part A situation where your work history can allow your spouse to have no-cost Part A, with Part B, if you file taxes jointly, you and your spouse will show the same income figures and each be responsible for the IRMA premium amount if they apply. Wrapping up Original Medicare Parts A and B, the coverage itself is all individual, so any deductibles, co-pays, co-insurance, those amounts are for you and do not cover your spouse. Your spouse's Original Medicare will cover him or her and not you. Now, Original Medicare leaves several significant gaps in coverage that bring a lot of financial risk. This video right up here goes into more detail around those gaps, and how most people decide to fill those gaps is by either keeping Original Medicare and getting a supplement plan to fill in the Part A and Part B gaps, or replacing Original Medicare with an Advantage plan. These two plans work in very different ways, and each has its own strengths and weaknesses. This warrants a much longer conversation than what we have time for in this video, but supplement plans in general cost more upfront in the form of your monthly premiums, and in exchange for those higher premiums, you typically get much more freedom to choose providers and much more straightforward access to healthcare services. Supplement plans typically do not cover anything other than the Part A and Part B gaps that we've mentioned, so supplement plans do not cover prescription drug coverage, dental, vision, hearing, or long-term care, but you can purchase those plans separately. Advantage plans have much lower monthly premiums, often $0. They typically come with other benefits like prescription drug coverage, dental, vision, hearing aid coverage, and other perks. The trade-off with the lower premiums is that Advantage plans are managed care. An insurance company can institute a provider network that you should stay within. They can institute prior authorizations, and they can deny certain procedures if the insurance company doesn't deem them medically necessary. There are a lot of nuances around these two options that are covered in a lot of detail in this video right up here. The point is that the decision to get a supplement plan or an Advantage plan should be made together with your spouse. Your financial situation will determine what is most realistic for you, your current health situation, the prescriptions each of you take, your risk tolerance, and the understanding that if something happens to one of you, the other will likely need to deal with all of the plan specifics, the bills, and the questions. These are individual plans. They should be a mutual decision. So regardless of which plan that you pick, any of the supplement plans or any of the Advantage plans, here it is again, it is an individual plan. It only covers you and does not cover your spouse. Any premiums, deductibles, co-pays, co-insurance, or out-of-pocket maximum amounts apply to you and to you only. What this also means is that you and your spouse can get different plan types and plan options. One of you can get a supplement plan while the other gets an Advantage plan. In fact, my parents did exactly that. One of them has a supplement plan, the other one has an Advantage plan, and they both love what they have. All right, the next part of Medicare to discuss is prescription drug coverage. As I mentioned earlier, supplement plans do not come with this coverage, and you would need to purchase a separate individual drug plan for yourself. And your spouse would also need to get a separate one as well if you both went the supplement plan route. These separate Part D plans have their own premiums, their own deductibles, their own copays, and coinsurance amounts that you are each responsible for. Like Part B, Part D premiums are also based on your income, and you could see that additional IRMA pop up again. Here are the income brackets and the additional amount that you would each need to pay and add to your Part D premium if applicable. So if you had a Part D plan that had the average premium of about $32 a month here in 2023, and you were in this bracket, you would need to add $31.50 to your premium for a total of $63.50 as your monthly Part D premium per month. Your spouse would need to go through the same exercise for his or her individual Part D plan. Now, Medicare Advantage plans often come with Part D coverage included in that $0 premium or low premium. If IRMA applies, you would still be charged that IRMA dollar amount and it would be paid to the Advantage plan. If you do not pay that IRMA amount, your plan will cancel, so keep track of that IRMA figure and make sure that you're paying it. All right, the last thing I'll cover in this video is long-term care. Long-term care would include things like nursing home care, dementia, Alzheimer's facility care, and home health care. I mentioned it earlier as something that original Medicare, supplement plans, and Advantage plans do not cover. Medicare does not touch long-term care. And as we talk about the financial impacts to you and your spouse, long-term care has the highest likelihood of having both the highest dollar impact and the highest emotional impact to you and your spouse. Remember that if something does happen in the form of healthcare, chronic care, or disability, the spouse is the one put in charge of handling all of the logistics of these decisions. Having something in place to address the long-term care possibility is something not often discussed, but it is so important. The biggest problem is that once the need for long-term care is happening, it is too late. The best time to look into long-term care plans would be between 50 and 60 years old. These plans require medical underwriting where they will look at your health and decide if you qualify for one of these plans. The highest likelihood of qualifying and being able to afford these plans falls between 50 and 60 years old. We will have more videos that go into more detail around long-term care because of its importance. You can get individual long-term care policies, or if both you and your spouse can qualify for one, there are shared policies that are more cost-effective. As you can see, while Medicare is an individual plan, there are a lot of factors that make it a mutual decision with you and your spouse. As you both approach these decisions, we always recommend working with an independent agent that represents both Advantage and supplement plans, as well as several different insurance companies, so that you can get the plan that will work best for you and your spouse. Using an agent to help you with Medicare never costs you anything. You don't pay agents, and you don't pay any more for the plans if you use an agent. An agent will understand how one decision that is over here will impact all of the other decisions in the other aspects of your life, and they can guide you through this process, not just when you sign up for Medicare for the first time, but for the rest of your life. I'm not even saying use us, use our competitors. Just please get started early and use an agent. If you don't have that person in your life, we're always here to help. All right, that's all I got for this video. Thank you for taking the time to watch and to learn more about how to protect yourself and your spouse. If you found it helpful, a like and a comment is always nice. As always, I appreciate you and thank you for watching.